Did you know that two of the most common hormonal problems affecting women may be more closely linked than you think? Polycystic ovary syndrome and thyroid dysfunction have overlapping symptoms, but the connection between them can be surprising. In this video, we'll explore how these two hormonal systems affect each other and what this means for your health. If you've ever felt lost in the midst of irregular menstrual cycles, unexplained weight gain, or extreme tiredness, stick with me, because the answer may be much closer than you think. Let's explore the relationship between polycystic ovary syndrome and the thyroid, organizing the discussion into 6 topics: what it is, effects, symptoms, diagnosis, treatment, and lifestyle tips. 1. What is it? Polycystic ovary syndrome is a common hormonal condition affecting women of reproductive age, characterized by a hormonal imbalance that can lead to a variety of symptoms. Although the name suggests the presence of cysts, not all women with PCOS have these cysts visible on their ovaries. PCOS can be caused by factors such as insulin resistance, inflammation, and genetic issues, resulting in menstrual irregularities, weight gain, acne, hirsutism, which is excessive hair growth, and hair loss. On the other hand, the thyroid is a butterfly-shaped endocrine gland located at the front of the neck, responsible for producing essential hormones such as thyroxine, T4, and triiodothyronine, T3. These hormones play a fundamental role in controlling metabolism, influencing how the body uses energy, regulates temperature, and controls growth. Thyroid function is vital to overall health, as its hormones affect various bodily functions and influence the production of sex hormones. The relationship between PCOS and thyroid dysfunction is significant, as the two conditions can coexist, and the presence of one can impact the other, further complicating the clinical picture and symptoms. 2. Effects. The interaction between polycystic ovary syndrome and the thyroid results in various effects that can influence a woman's health. Firstly, PCOS can affect thyroid function. Women with PCOS often have insulin resistance, which can lead to increased levels of androgens, better known as male hormones, and consequently impact the production of thyroid hormones. This can result in conditions such as subclinical hypothyroidism, where thyroid hormone levels are low but symptoms may not yet be evident. On the other hand, thyroid dysfunction can also aggravate the symptoms of PCOS. For example, hypothyroidism can contribute to weight gain, extreme tiredness, and menstrual irregularities, which are common symptoms of PCOS. When a woman has both conditions, the challenges of managing symptoms are multiplied, as the treatment approach for one can interfere with the other. In addition, both PCOS and thyroid problems can affect metabolic health. Women with PCOS are at greater risk of developing insulin resistance and type 2 diabetes, while hypothyroidism can slow down metabolism, increasing the risk of obesity and other metabolic complications. This interconnection makes integrated assessment and treatment of both conditions crucial, with the aim of improving the patient's quality of life and general health. 3. Symptoms. The symptoms of polycystic ovary syndrome and thyroid dysfunctions, such as hypothyroidism and hyperthyroidism, can overlap, making diagnosis and treatment more challenging. In the case of PCOS, the most common symptoms include menstrual irregularities, which can manifest as irregular or absent menstrual cycles. Many women with PCOS also experience weight gain, especially in the abdominal region, which is often associated with insulin resistance. In addition, dermatological symptoms such as acne and oily skin are frequent, as is hirsutism, characterized by excessive hair growth in areas where men normally have thicker hair, such as the face and chest. Hair loss or thinning can also occur. On the other hand, thyroid-related symptoms vary depending on the type of dysfunction. In hypothyroidism, which is a condition in which the thyroid does not produce enough hormones, symptoms can include extreme fatigue, weight gain, sensitivity to cold, constipation, dry skin, and thin, brittle hair. Women may also experience menstrual irregularities and fertility difficulties. In contrast, hyperthyroidism, which occurs when there is an overproduction of thyroid hormones, can cause unexplained weight loss, increased heart rate, anxiety, insomnia, and excessive heat. These overlapping symptoms can make it difficult to diagnose correctly, leading to inadequate treatment. It is therefore essential that women who show signs of PCOS and thyroid dysfunction seek medical evaluation for an accurate diagnosis and an appropriate treatment plan. Before continuing, if you're learning about the thyroid and want to delve even deeper into your health, check out the video description for my exclusive ebook with valuable information and practical tips to better understand your thyroid health. Also, subscribe to the channel Turn on notifications and join our community to find out more. 4. Diagnosis. Diagnosis of polycystic ovary syndrome and thyroid dysfunction involves a combination of clinical assessment, laboratory tests, and, in some cases, imaging tests. For PCOS, the diagnosis is often made when the patient has at least two of the following three criteria: menstrual irregularities, signs of hyperandrogenism, such as acne, hirsutism, and hair loss, and the presence of ovarian cysts identified by ultrasound. Transvaginal ultrasound is a common tool for visualizing the ovaries and detecting cysts. In addition, laboratory tests can be carried out to measure hormone levels, such as androgens and insulin, and rule out other conditions that can mimic PCOS, such as thyroid problems. For the thyroid, diagnosing dysfunction usually involves blood tests to measure the levels of thyroid hormones, including TSH, thyroid-stimulating hormone, T3 and T4. TSH is particularly important, as high levels can indicate hypothyroidism, while low levels can suggest hyperthyroidism. In some cases, the presence of specific antibodies can be tested to identify autoimmune thyroid diseases, such as Hashimoto's or Graves' disease. Imaging tests, such as thyroid ultrasound, can be used to assess the structure of the gland and identify nodules or other abnormalities. Given that the symptoms of PCOS and thyroid dysfunction can overlap, it is important that women who experience one or more symptoms of both conditions undergo a thorough, multidisciplinary assessment for an accurate diagnosis and effective treatment. 5. Treatment. The treatment of polycystic ovary syndrome and thyroid dysfunction requires a personalized approach, taking into account the specific symptoms and needs of each patient. For PCOS, treatment options can include lifestyle changes, such as diet and exercise, which are key to managing symptoms. Losing weight can help regulate the menstrual cycle and reduce insulin resistance, which is crucial for many women. Medications such as oral contraceptives can be prescribed to regulate menstrual cycles and treat symptoms such as acne and hirsutism. Anti-inflammatories and drugs that help control insulin, such as metformin, are also often used to improve insulin sensitivity and regulate metabolism. As for the treatment of thyroid dysfunctions, the options vary according to the condition. For hypothyroidism, treatment usually involves thyroid hormone replacement, usually in the form of levothyroxine, a synthetic hormone that helps normalize TSH and T4 levels in the body. For hyperthyroidism, treatment can include antithyroid drugs that reduce hormone production, radioactive iodine therapy to destroy part of the thyroid gland, or, in more severe cases, surgery to remove part or all of the thyroid. In situations where PCOS and thyroid dysfunction coexist, an integrated approach is essential. Treatment must be coordinated between healthcare professionals, ensuring that drugs for one condition do not interfere with the other. In addition, regular monitoring of hormone levels and adjustment of therapies are key to ensuring that patients maintain a healthy balance in their hormonal system. Emotional support and education about the condition are also important components of treatment, helping women to understand and manage their conditions more effectively. 6. Lifestyle tips. Adopting a healthy lifestyle can have a significant impact on the management of polycystic ovary syndrome and thyroid dysfunction. Here are some useful tips. Balanced diet. Opt for a diet rich in nutrients, including fruit, vegetables, whole grains, and lean proteins. Reducing your intake of refined carbohydrates and sugars can help control insulin levels and regulate weight. Weight control. Even moderate weight loss can have a positive effect on regularizing the menstrual cycle and reducing PCOS symptoms. Incorporating regular physical activity, such as walking, weight training, or aerobic exercise, can be beneficial. Regular exercise. Physical activity not only helps maintain a healthy weight, but also improves insulin sensitivity, reduces stress, and can improve mood. Try to include at least 150 minutes of moderate activity per week. Stress management. Practices such as yoga, meditation, and breathing techniques can help reduce stress, which can exacerbate both PCOS and thyroid problems. Taking time to relax and look after yourself is crucial. Quality sleep. Prioritizing adequate, quality sleep is fundamental to hormonal health. Establishing a consistent sleep routine and creating an environment conducive to rest can improve overall well-being. Hydration. Staying well hydrated is important for metabolism and general health. Water is essential for the body to function properly, so try to drink at least 8 glasses of water a day. Supplementation. Consult a doctor about the possibility of including supplements such as vitamin D, omega-3, and folic acid, which can be beneficial for hormonal health. Regular medical follow-up. Making regular appointments with health professionals to monitor hormone levels and adjust treatment as necessary is essential for effective management of conditions. Incorporating these tips into your daily life can not only help control the symptoms of PCOS and thyroid dysfunction, but also promote a healthier and more balanced lifestyle. If you're experiencing symptoms such as menstrual irregularities, unexplained weight gain, persistent acne, hirsutism, or any other sign associated with polycystic ovary syndrome or thyroid dysfunction, it is essential to seek help from an endocrinologist or gynecologist. These professionals specialize in hormonal conditions and can provide a comprehensive assessment and an accurate diagnosis. Seeing a doctor is crucial because a professional can carry out the necessary laboratory and imaging tests to confirm whether you really have PCOS, thyroid problems, or another hormonal condition, ensuring that the correct treatment is started. In addition, each case is unique, and a doctor can design a treatment plan that meets your specific needs, taking into account your symptoms, health history, and lifestyle. Another important aspect is that many hormonal conditions require ongoing monitoring. Seeing an endocrinologist or gynecologist allows you to have regular support to monitor the effectiveness of your treatment and make adjustments as necessary. If left untreated, conditions such as PCOS and thyroid problems can lead to serious complications such as type 2 diabetes, heart disease, and fertility difficulties. Early medical consultation can help prevent these problems. In addition to physical treatment, these professionals can offer emotional and educational support, helping you to better understand your condition and how to manage it. Don't ignore the signals your body is sending you. Seeking medical help is an important step towards improving your hormonal health and, consequently, your quality of life. In summary, the relationship between polycystic ovary syndrome and the thyroid is complex, but understanding this connection is fundamental for effective treatment and a better quality of life. Remember that proper management of hormonal conditions can make all the difference to your overall health and well-being. If you found this video informative, don't forget to like, share, and subscribe to the channel for more content on hormonal health. And, of course, share your experiences or questions in the comments. Your journey could help others who are going through the same challenge. See you next time.